Can dogs eat chocolate and be okay? In most cases, the answer is yes. But it depends on your dog and the type of chocolate. Most people know chocolate is toxic to dogs. But that doesn't mean accidents will never happen. What if your dog has eaten chocolate already? Here's what you need to know, what you need to do, and when you need to call your vet. What should I do if my dog eats chocolate? If you know your dog ate chocolate, don't wait for symptoms to begin. It's important to get it out of his system quickly. There are 4 items you should always have in your first aid kit in case your dog eats chocolate. 3% hydrogen peroxide. Activated charcoal, food grade. Bentonite clay, food grade. 50 ml syringe, you can get them in packs of assorted sizes. If you know for sure that your dog ate chocolate, stay calm. Here's what you need to do. Step 1. Figure out how much your dog ate. First you need to gather some information. You need to know when or how long ago he ate chocolate, how much chocolate he ate, what kind of chocolate he ate, how much your dog weighs. Then use this chart to figure out how many milligram per kilogram of body weight your dog ate. Stop. Note, if your dog ate a substantial amount according to the chart, you'll want to talk to your veterinarian. She'll determine if you should induce vomiting or if she should. She'll also decide if your dog needs activated charcoal. She has ways to make both processes easier. If the amount is low and there are no symptoms, it means he didn't eat much, or that he ate it recently. In this case, take the following steps. Step 2. Make your dog vomit. If your dog ate chocolate within an hour, get him to vomit. Use 3% hydrogen peroxide solution. Mix it 1:1 with water. Use 1 teaspoon per 5 pounds of the dog's body weight. Use a maximum of 3 tablespoons for dogs who weigh more than 45 pounds. Your dog needs to swallow the peroxide. Use a syringe to squirt it as far back into your dog's throat as you can. Hold his mouth closed and rub under his chin and throat, or blow into his nose to get him to swallow. This is also the method I've used to get my dogs to swallow a pill. Wait 15 minutes and if he doesn't vomit, give him another dose, but no more. The sooner the theobromine gets removed from the body, the better your dog's prognosis. If your dog ate the chocolate recently, you'll see it when he vomits. That means it has not digested. Step 3. Ask about activated charcoal. As a second measure, ask your vet if activated charcoal is appropriate for your dog's situation. Activated charcoal will block absorption of the theobromine into the body. But use caution. The ASPCA Poison Control Center warns that it should only be used for high-dose chocolate toxicity in dogs, because it may cause hyponatremia, high sodium levels, which can be risky. Your vet will tell you how often to dose. The standard dose is 1 to 5 grams per kilogram of body weight depending on the amount of chocolate eaten. It's best if you can start this within an hour of eating the chocolate. The APCC suggests sprinkling some on food, yogurt or baby food, anything to get him to lick it up. Or give it mixed with water in a syringe. Squirt it in as you would for hydrogen peroxide. Give it a little bit at a time. Giving it by mouth is a last resort as he can choke and it can get into your dog's lungs. If your dog has no signs of chocolate poisoning, add it to his water bowl. Step 4. Give bentonite clay. You can use bentonite clay alongside activated charcoal or on its own. It's used to remove toxins. Bentonite clay absorbs waste produced by cells in your dog's body. It binds with toxins in the gut and absorbs toxins before they get processed by the liver and kidneys. It protects the gut lining from letting toxins through. In this way it can reduce your dog's nausea, diarrhea and vomiting. Bentonite clay isn't digested, so when it leaves the body, it takes the toxins with it. You can find it as a nutrition supplement at your health food store. Add it directly to wet food. Do not feed from a metal bowl or use metal utensils to stir the clay. It will absorb metal from the utensil or bowl. Use a ceramic or glass bowl to feed and a plastic spoon to stir the clay into wet food to activate it. Dosing: less than 20 pounds half a teaspoon, 20 to 50 pounds 1 teaspoon, 50 to 90 pounds 1 tablespoon, greater than 90 pounds 1 to 2 tablespoons. Make sure your dog has plenty of clean water always available. Clay is highly absorbable, so you don't want to cause any constipation issues. Also continue to watch for vomiting, diarrhea, thirst and restlessness.